Hi, Professor Marshall. I'm going to perform a female catheterization. While I'm doing that, I'll give you details on what I would do if this were a male patient. I've already checked the patient's files, made sure that this is an order that's in place. I have spoken with the patient and let them know the details about the procedure, and I also have asked about any allergies, like as to latex or iodine. So I will get started by raising the head of the bed to a more comfortable height for me. And I have the patient in a dorsal recumbent position so that it will be a little bit easier for me and for the patient to provide the catheterization. So initially I am going to perform hand hygiene, and I'm going to don some gloves. And spreading the patient's legs, I will place a chucks underneath in case any water leaks through my kit. And if I needed any help with a larger patient or a patient that's not as easy to perform this procedure on, I would get assistance from another patient or another nurse. Okay, first I'm going to clean the peri area with wipes preferably, but I only have a washcloth now, so I'll use a washcloth to do this. I would change my wipe every time, going around each one, switching out each one, always going from front to back to clean the peri area. Then I will discard my non-sterile gloves and open my sterile packaging. I just like to use this as a trash. It's just a little bit easier, and this patient has been very nice and is not moving their legs, so they're not kicking it around for me. So I will open my sterile packaging. Carefully removing my sterile gloves and the drapes. And now I will don my sterile gloves. And I will place the drapes around the patient. So I'll have a sterile field. Actually, I want to do this a little bit longer, bigger sterile field. Making sure that I don't touch the patient in any way because I have sterile gloves on and I don't need this for the female, I don't think, so I'm gonna leave it. For a male, I would put this over the penis with the hole, just the penis outside of the hole, so that I have more option for a sterile field. I will move my tray onto the patient's bed, asking the patient to try not to move as much as possible so that I can continue to have my sterile field. And I'm placing the Foley bag onto the sterile field, the patient as well. I'm going to remove the lubrication and squeeze it into the tray. For a male, I would keep this and then insert it into the meatus of the penis to help for more lubrication, but for the female, I've inserted this. I'm gonna discard it. I'm gonna open up my iodine and get my cotton swabs wet with iodine and discard that. I am gonna remove the catheter tube, ensuring that I'm not touching anything so that it stays sterile. And I will place it into the lubricant and leave it there so that I have the space. I will attach my sterile fluid to inflate my balloon and the catheter tip. And now I'm completely set up, so I'll get started. Now that I have my iodine on my cotton swabs, I will clean the peri area. This is now gonna be my dirty hand, and this will be my sterile hand. I'll open the lips of the labia and start from the outside and swipe, discard. I'm gonna use all of them because I wanna make sure that I'm able to see the meatus as I'm doing this. Cleaning from front to back. From front to back. Discarding. Okay, so now as I'm holding open the labias, I'm going to swirl the catheter into the lubricant. For a male patient, I would just insert this into the meatus because it's a little bit easier to find. For a female patient, if I'm unable to see it, I will ask them to cough and see if I can get the a little bit of movement so that I can see the meatus. But for this patient, I can see it and we're all good. So I'm going to insert into the meatus without touching anything, only holding back a couple inches. There we go. Inserting into the meatus until I get a urinary return into the catheter tube. For a male, I would push all the way up into the bifurcation to ensure that I'm through up into the bladder. That way, when I inflate the balloon, there's no way that I'm in the urethra still. For the female, I don't have to go up as far, but I'm in there. We've got urinary return, and I will inflate the balloon. And then I will pull back ever so gently just to make sure that it is up into the bladder and secured with the patient. I will discard of my supplies. Attach the bag to the patient's thigh with a secure clip, and then I will hang the bag off the side of the bed underneath the level of the urinary bladder so that it flows into the bag. Once I'm finished, I will give the patient, I will ask how the patient is doing, I will set the bed down low, and I will exit the room.